Hello, everybody, and welcome back to the Physician's Mind podcast. I'm your host, Curtis Wilkerson. I'm an incoming medical student, and I designed this show to engage the curious mind on the journey of lifelong learning and self improvement in medicine and beyond. Today, I have part two of my interview with Dr. Chris Fullmer, a first year plastic surgery resident at Penn State University, who's also an osteopathic physician. Chris shares some incredible insight about the challenges he overcame and what it takes to succeed in medicine, especially as an osteopathic physician. So if you enjoyed this episode, please share on Spotify, Apple Podcasts, or YouTube. Without any further ado, here's part two of my interview with Dr. Chris Fullmer. Thank you so much for tuning in. Well, I was curious as well. I mean, in terms of your board scores, in terms of GPA, were you a hyper competitive guy or were you above the minimum acceptable? Like where were you at in your board scores, percentile wise or however?
Yeah, that's a great question. I thankfully, the way I got into medical school, or not got into medical school, but once I started, and it was like, okay, how do I succeed at this medical school thing? I think, I guess some advice when it comes to studying, the way that I went about it was I I believe in the active learning strategies. You can Google that, look it up. There's a few different ones. Spaced repetition or flashcards. I used Anki. I know some people probably will cringe when they hear that word. But for me, it really worked. But whatever it is, I think it needs to be an active learning strategy, not passive, where it's just reading notes again or like looking at slides again. It's inefficient. It's not effective. Because in medical school, I realized it's like I need to maximize this little amount of time that I have to learn as much as possible. Because it
Hmm.
is a lot of just memorize a bunch of facts, regurgitated on a test. And it's silly, and I don't fully support that kind of like learning strategy, but it is what it is. And so I'm like, okay, I need to be good at this. So I need to memorize a bunch of facts. Flashcards are great at that. Um, and so that's how I approached it. So I started using Anki, and that was a learning curve. I think a lot of people I feel like struggle with Anki because it's tough to figure out what works best for you, and it's almost like I had to learn how to learn in a sense, and that was a little bit difficult, especially starting medical school. But once I kind of started hitting my stride, and I took the time to really build a strategy around how to use Anki and how to use it effectively. And I went through that learning curve phase of like, I don't know if I'm even doing this right, but it was a little bit of trial and error. But I also joined a study group where other people were using Anki as well, and we would split up making decks and sharing them with each other. And so I got to see how like they were using it. And it was kind of the asking for help. So I would incorporate kind of how they did things, and then it just maximized my potential. So I really succeeded academically in medical school. Midwestern does like a GPA. I actually got letter grades. So I had a GPA of like a 3.94. Um,
Incredible.
yeah, I did well taking tests. I think that was a strong aspect on my application. And I implemented the same strategy for studying for Comlex and step one, two, and now I'm taking step three at the end of this month. But yeah, I utilize flashcards for that, and then also doing a lot of practice questions. And I was also the first group that step one and level one were pass fail, so that was kind of an interesting thing to navigate. And I think that also threw a wrench into getting audition rotations. Because now that was one less thing that helped me differentiate myself because I passed like everybody else did. Um, and then on step two, I got a 254.
Mhm.
Um, so I think that's average for plastic surgery. It wasn't anything crazy, but it's a good score. I was hoping it'd be higher, but I can talk about board scores later because I don't feel like it's kind of the end all be all. It's an important number, but not important in the sense of like it needs to be the highest number possible. It's kind of like what you said, as long as it's not like a red flag, it's not gonna like it's gonna be fine. Failing it would be disastrous.
Oh yeah.
That would hurt the application for sure. Unfortunately, again, I don't agree with the whole matching into the whole process and trying to like get into a residency spot is ridiculous to me, but it's the system that we're using. So it was kind of like, oh, it's unfair and I don't agree with it, but like, I'll make it work. So yeah, I got a 254. And then on level two, nobody asked me about my board scores on any of my interviews, but I got a 676 on level two. But I mean, if you're applying plastic surgery, that number probably doesn't mean much to any of the program directors because they're probably like, oh, is this a good score, a bad score? But yeah, so that's kind of how I succeeded academically. So I think from the numbers perspective, I looked good. Research severely lacking. I had a lot of stuff that was in progress. I did over the summer like a research fellowship at Midwestern, so I had multiple poster presentations. Some of the other people that I worked with on their projects, they did presentations at a few other conferences, but it was like basic science, cardiovascular type research, so it wasn't related to plastics, but it was something. As far as surgery and plastic surgery related research, I only had a few items. One of them actually just finally got published. It's like the first thing that my name is on that's ever been published, and it's like 6 months into intern year. Um, but that's the annoying thing about research is it's like it can be a little bit political. It's a grind. It takes a long time. So my research part of my CV was it was sad. And I mean I knew that, but it was kind of the calculated risk. And I knew if anybody asked me on my interview, I had my answer. It was like, I decided not to take a research year, and if they asked me why, I could explain it, kind of the reasons I told you. Um, but I was proud of what I did have because I didn't have a lot of support, so I found stuff on my own. I worked as hard as I could. This is what I got. Like, I'm sure if I was at another institution that had everything set up for me, I'd have a lot more. But in my head, I was like, who's going to be a better resident? Somebody who has 30 applications or somebody who has like 10 or 15? And if they can't answer that question, I'm like, okay, then why are we using this number? Like, it seems a little arbitrary to me. I think having no research might be like, okay, plastic surgery is a research type of field. It's kind of incorporated. All residency programs are going to have some sort of research requirement. So if you have nothing, it might be like, I don't know. But I had a little bit with what I did have. And so that was probably the one part of my application that was lacking. And then as far as like leadership, volunteering, all that stuff, for surgical specialties, it's not as important, but I think it's important to have stuff that you're passionate about, to show some of that personality, and some of those unique experiences. So I'd say if you are going to volunteer, if you are going to do something that you actually care about. So that way, when you write about it, and then if they ask you about it, I could say more than just like, the generic, like, oh yeah, it was a great experience. I got to like get outside of myself and help people and blah, blah, blah. But if it was something that I actually was passionate about, it'd be like, oh yeah, well, I did this and I really care about it because of these experiences in my life. And this is why I wanted to help them because I've experienced this. And like there could be a story behind it. And I think that adds a little bit more. And I tried to add that into my application. In the few words that they give you, I tried to type out like, this is why this matters to me. But if they ask you about it in an interview, it's something that you can actually speak towards, so not just have like the generic, it was a good time.
Yeah, because ultimately nobody wants to hear that.
Oh yeah, again, it just sounds like everybody's going to have, again, you read a million applications, everybody's experiences will start blending together and it'll all sound the same, but you can start picking out if somebody did something that was like unique to them and why it mattered. Like why it matters to you is going to be unique, not the actual thing that you were doing.
Right. Like you could do anything. And I think,
Right.
on your research thing, it's like that's another example of not a red flag because you didn't have no research. You had some research,
Yeah.
and you clearly did well in the audition. So they're like, we like Chris, we're going to interview him. And connections were made. And
Yeah.
ultimately, with the disciplined initiative, you were able to succeed. So again,
Yeah.
as a DO, it's like no red flags, take the initiative and network, navigate that chaos and
Absolutely.
be happy with the results. So when it comes to being on an audition well, actually, before we kind of talk about that one thing too, like you touched on the active learning strategies.
Yeah.
I I, I like those a lot. I think those and it, regardless of what I think the studies have actually shown that those are the most effective ways. Like it's like
Yeah,
working out your
scientifically
muscles.
proven. If you want to learn something, that's how you do it.
Yeah, active learning like Anki and like where you feel that little pressure, that's like the learning happening.
Yeah.
So,
It takes a lot of work. I think actual learning takes a lot of effort and it can be exhausting. Long study days, I would just pass out, fall asleep just because mentally it was so exhausting. And so, yeah, I think, but it's the way that you learn. There were a lot of times I'd be studying like 10 different subjects because I have all these tests coming up. I'm like, is this even going in my brain? And then the next day I would, do my review flashcards. But then I would actually be like, oh, I'm like, I remember this. And then I'd go take the test and it would be like, oh, yeah, this thing is this thing. And like, it proved to me that it was working. And then when I slacked at it, or I tried to do other things, or I was being lazy, um, or I just was kind of blowing through my cards, not actually like processing it, and then my test would suffer for it. I'd be like, okay, time to, we need to go back to the things that we know that work and work them well.
hmm there's
So,
no way around it. No way
yeah.
around it. Huh. Yeah, it's like a marathon. Well, it's like a marathon, but it's like you're just sitting in a chair and hammer it out in your head.
Oh yeah, and when you take your level one, step one, and then level two and step two, it's the same thing. Like you're just sitting down for 8 hours, just like grinding questions, and it's a mental challenge more than anything else. It'd be a similar thing as if like, all right, go run this 5K, go run this marathon. You're just doing that, but mentally.
Yeah. So now you matched. You're in. How many months have you been in now? About six.
Yeah, 6 months, almost halfway through intern year now.
So the transition from medical school to residency, what was that like? And also, before you answer that, how did it feel once you found out you matched? I mean,
Oh,
what was that like?
that was. Leading up to match was a rough week. Well, I guess I'll back up because I kind of need to set the context. My audition rotations didn't fall into place as planned, but my whole life has fallen into place not as planned. But um, because you typically like generic, the way that it works is applications are due in September. Interviews are like fall, winter, going into January, maybe one or two beginning of February, and then match days in March. So typically, you want to rotate at places June, July, August, September. Maybe in October, just like get some more exposure, connect with some. But you typically do it before applications are due. That way, programs know you when you apply. I tried to do that, but again, I had only a pass fail, step one. Um, and a lot of audition rotations, and this is look into it. It's like applying to medical school. Every program is going to have different things that they want. They might have like, oh, write a paragraph on why you want to come here. Some of them might require a letter of recommendation. And so I actually had one of my general surgery mentors write me one, because the plastic surgery mentors weren't able to get me one. So I don't know if that worked against me, but it was better than nothing.
Yeah.
But I didn't, I had this whole plan. I was like, I'll apply to all of these ones July through September, and then I'll have all of these ones as backups. And then got rejected from all of them.
Oh
So
man.
everything fell out of place. And so then I was like, okay, we'll do this general surgery audition rotation in August instead, so that way I can get my Gen Surg application squared away. And I just I was looking at all these programs. I talked to a few of my other mentors, and some of these mentors, they don't have to be attendings. So if I was a third year medical student, there were a couple fourth years that I was talking to. There were other residents that I was chatting with, PGY1 through chief year, either at plastic surgery programs or even just like surgical programs, getting their input and advice. So a few of them pointed out like, oh yeah, I'll apply to these programs. Just so I applied to like all these plastic surgery programs for all the months, and then a few of them started coming through, but they were all later in the year. And then Mayo Clinic, because I was bugging them and I was like the thorn in their side that never left. I actually had Penn State's audition rotation in November, and then Mayo called me and they said, "Hey, we actually had a spot open up. If you want to rotate with us, you can rotate in November." I'm like, "You got to be kidding me."
Yeah, damn it.
So then I'm reaching out, I'm like, again, emailing everybody, and it worked out. Like Penn State was so accommodating. They're like, "Yeah, you can rotate with us in January." And I'm like, it's like right before like rank lists are due in February. So that's like the last month you can like rotate a place. That makes sense. Um and so all of my rotations were actually October, November, December, January. And so I actually got interviews coming out in September, October, and then into November. And then I was doing interviews while simultaneously doing audition rotations. I don't recommend that. I was exhausted all the time. Doing like a full day interview and then the next day being like, okay, I have to go in and I'm on call and we're covering hand and face and I'm probably not going to sleep tonight. Like, um, it was a lot, but again, kind of that mentality of like, life's unfair. It worked out. I'm grateful to be here. Um, Again, I'm just going to work hard. And I think having a good attitude is probably the most important thing when you're on audition rotations. And so even though I was tired, I was always grateful to be there because I almost didn't get any audition rotations. Like for a second there, I was like, I'm not matching plastics because no one will let me rotate with them. But then when everything fell into place later in the year, it was like, this sucks. This is really inconvenient, but it is what it is. Like, I can't control this, but I'll take what I can get. Um, and so it's funny, the place I matched at was actually like the last place I rotated. So, January of technically this year, I was a medical student at Penn State doing an audition rotation,
Now that is something.
hoping that I would match somewhere. And the fact that they were so accommodating, and then when I rotated there, they were so nice, and everybody was amazing that I mean, it was a great experience. And so going into match day, January is my last audition rotation. I finally finish out all my interviews. Go into February where I like finalize my rank list, and then it's just like stress and anxiety. The mental toll that like waiting for match day takes, I don't think people understand that. Like, it's nice
Oh,
because I had nothing going on. And so me and my friends, again, this is where having like a good group of people in medical school, like some of these friends are going to be lifelong people because you sit there and you're like, I have no idea where I'm going to live in the next couple months. And again, the toll that it took on my wife, I think spouses and family members of people who are in medicine, like props to all of you. Um, when she's sitting there and she's like, I don't know if I'll be able to keep my job because I don't know if we're staying, if we're going, I don't know what we're gonna do. Like it was that was not a fun month. It was fun because I was able to like hang out with my friends and actually have free time. But it was not fun because my wife and I just sat there and were like, what the hell's gonna happen?
oh man, yeah.
Um, Again, it's like the unknown. How is life going to fall into place, and how do we plan for that? You can't. You just sit there and wait for the inevitable. But like you asked, so match day rolls around, and if you dual apply, it's almost even worse because Monday the email comes out that says, "Hey, you matched," and so, but then I'm like, "Great, I matched, but in what?"
Oh my gosh, doesn't even tell you.
Yeah, so it. I was grateful because I also, again, backup plans. I don't think people talk enough about not matching either. I had several friends not match and go through either the SOAP process or process of, yes, SOAP doing prelim year, reapplying, or they partially matched and now they have to reapply again. Um, and it can suck. And it's a very bittersweet moment that morning because everybody's texting, and then you have the one friend that's quiet, and you're like, oh no, like. And how I didn't even know how to reach out to them. It was like, "Are you okay? What's going on?" Um, because now, if they're going through the SOAP process, their life is a complete mess right now. They're trying to scramble and like get either letters of recommendation or revamping their personal statement. And so, me texting them, being like, "Hey, are you okay? What's going on?" I don't know if that's annoying or if it's helpful because everybody's celebrating, but they're like having the worst day of their life. Um, I think more people should be not I don't know if transparent's the right word, but just like openly talking about what it's like to go through. the not matching because it was a rough morning. I think it was exciting because I got the email and it said I matched, but I also had a backup plan. I fully considered that maybe I don't match in anything and I have to soap. And so
Yeah.
I had like my people on standby that if shit hit the fan, I could call them for help, maybe take the day to cry my eyes out and then be like, okay, let's approach this one step in front of the other. We'll do this. We didn't plan on this, but hey, we'll take care of it. And so I had like everything set up. The morning comes, I get the email, it says, "Hey, I matched." I have no idea in what. I'm just grateful. Okay, I don't have to soap. But then I'm happy I matched. There are people that are important to me that didn't match, and so it's like again a bittersweet. It's a weird day. Um, uh, and yeah, again, I don't think people talk about that enough. Because it's like you're happy, but then also mourning because your friends are going through hell. But it's a rough week because I just sit there and I'm like, okay, did I match plastics or general surgery? In my head, I basically had already decided it's general surgery because again, statistically speaking, I'm like, that's more than likely what I matched into. And I was really happy with several of my general surgery interviews and some of the programs I rotated at. And so I figured I'd be okay. And then the morning of that, again, I hate just like sitting there and like it's like this countdown to like you get the email, you get to finally open the envelope or whatever it is that you do. And again, my mentality was it's general surgery. And then when I opened it up, I remember all I saw it said like integrated plastics, Penn State, and I just started sobbing.
Oh man, that's
I
beautiful.
like I don't know the absolute euphoria of that moment where it was just like we fucking did it. Like sorry, I don't know if you can swear on your
No,
podcast,
don't
but
worry
like
about it.
it's like that was yeah, I like my wife and I just like held each other as I just like cried into her arms. It was just like this
Oh
little
man.
kid. Um yeah, it was very emotional. All the hard work paid off. It was Um, and then all my friends were so supportive because they knew that this was kind of like a long shot. And so the fact that I was able to pull that off, everyone was so excited. And then actually my mentor, because his daughter, it was match day for her too, so he was there. And I remember I like held up the sign and he was so excited for me. And so I think just the excitement of everybody around you and everybody's pumped. Um, I that was a really cool experience, and I was just texting like my mom and then my brother and then all my other like mentors. It was just like, hey, like we did it. Thank you so much for your help. I think taking the opportunity because it took a village to get me to where I'm at. So just like yeah, thanking everybody that got me there. But I think another thing that people also don't talk about is kind of the bittersweet moment that happens later because it was I matched into plastics. This is amazing. Um, and then we get home and it's like we now have to move across the United States.
Yeah, from Arizona to Pennsylvania.
Yeah. And my wife was unsure about her job. They knew I was going into residency. They kind of knew the situation, but they didn't say like, okay, for sure, like maybe you can work remotely and she loved her job. She has a lot of good friends there. Her career had really taken off during the 4 years of medical school, so she was very established with where she was at and very happy. And so then it was like we cried at Midwestern when we found out that we did it. And then we came home and we cried because we were sad because it was like our whole life has just like changed now. Even though it's good, it was like we how do we navigate this now? Um, and that was again, I don't think people talk about that a lot either because even though like matching is a really happy thing, it can be really bittersweet. Because again, I saw a few friends that again they matched into really good programs, but like their significant other matched at a different program.
Oh, well.
And so then it's like, great, now like we're several states away. Like I don't know it it's hard because it's almost like I'm supposed to be happy, but at the same time it sucks. Like it was a weird feeling. and I know a lot of people experience that. I think if you match at your number one choice and it's everything you wanted and it's all going to work out perfect, like I think that's fantastic. But for me, it was an amazing opportunity. I'm so happy I matched, but then trying to figure out moving across the country. We had never lived on the East Coast before. We have no family out there. Like this is going to be a whole new journey for us. And that was a big, I think even now that we've lived here for 6 months, it's been like a lot of growing pains, a big learning curve, but I think again, the happiness, that intrinsic fulfillment, taking that with us from Arizona to Pennsylvania, even though it was tough, I think we're really kind of hitting our stride now. It's not going to ever be easy, but um, it's been a great but also growing experience. I guess that's probably the best way to put it.
That's interesting. Yeah, it was very nice to hear you share that, especially just when you open that letter, man, and it's right there, and you're like, boom.
Yeah. It was that dopamine hit real hard. Like that.
Oh, shit, I can only
I
imagine.
probably again probably top five happiest moments because it was. I mean, we're talking probably a decade worth of work. Going from, I mean, even just like surviving high school and then surviving undergrad and like doing the whole medical school application. It was, and there were, I mean, there were certain people in my life that were really supportive, and a lot of other people, like everyone had their doubts, and some people weren't supportive, and because again, it's the long game when it comes to medical school, and I don't think a lot of people see. Externally, I mean, me and you kind of see what we're succeeding at in the moment, but everyone else, it's like you've been in school for how long and you're doing all this stuff. It seems like treading water the whole time, not going anywhere. But then to finally like match into residency and just like it was a great experience. To be like all the work paid off. I have a job now. Like this is crazy. I've basically been slaving away for free, in the studying and grinding all the other things that you got to do to just get into medical school and then try to like make your application good for residency to then finally be like, okay, I have a job. Like, great. I'm excited.
Like it's here.
Yeah.
Man, yeah, that's cool. It's like the light, that light at the end of the tunnel that you've been just like not even at the end of the tunnel, that light at the top of the mountain that you've just been like tirelessly climbing towards.
Yeah. And it
Finally
seems like
get
it just
there.
never ends. And you're like, I mean, it's weird how like the days are long, but then the months are short. Like medical school is long, but then you blink and you're like in your fourth year applying to residency. And you're like, ah, what? It goes by real quick. So yeah, like what you said, it's just kind of that long. You climb to finally the top and you hit the summit, and you're just like, oh, like weight off the shoulders.
That's life. Now, I mean, man, that's just cool. Do you for we've talked about a lot. We've talked about taking the initiative to ensure your own success. We've talked about overcoming the adversity as a DO. Really, no excuses, whatever it takes, do what you need to do if you want to achieve. I
Yeah.
mean, we've talked about how you sort of overcame childhood, youth adversity, personal addiction in your early adulthood. I mean, just it's an inspiring story, Chris. It really is, and I think it'll open a lot of people's eyes to what's possible. I always like that sort of mentality. Just like you don't know, a lot of people don't know what they're capable of,
Yeah.
really deep within, and you're a testament to what's possible. So
And I think you mentioned that kind of that deep within thing. And I don't know what it was when I was an undergrad and my friend complimented me and said, hey, maybe you think about pre-med. And I think it was kind of that, can I do this? Can I prove to myself that I can do this? And I think it was kind of just what you described there. I think that was probably the initial spark that started this whole journey. Um, and now here we are.
yeah, yeah, it's cool to hear you say that because I had a similar thing. It was like I was gonna go to nursing school. My mom was a nurse. I was
Yeah.
like, I'm gonna be a nurse. And I remember we had a family friend over, Scott Perrine. Scott Perrine, he's
Scott,
like,
if you're out
Curtis,
there.
Scott, if you're out there, man, seriously.
Yeah.
He's like, what are you going to do in college, Kurt? I'm like, oh, I'm going to be a nurse. I'm going to go to study nursing. And he says to
Yeah.
me, this is my seed. He said, nurse? Why not go all the way and be a doctor?
It's like you never thought about it before and you're like, huh. Yeah. My
Like,
guy, it was Brian. Brian Lay, if you're listening to this, thanks, man. You
that's
started the
cool.
fire.
That's cool.
But
That's the best way to put it. It's like one of those things. It's in there and you're like, yeah, why not?
yeah. No, I think again everybody's journey and story is different, but yeah, again, I think it is, at least for me, I think it proved that, I can overcome and do hard things, but also it taught me a lot about having the support system and the people around you, even from whether that's personal relationships or professional. I think our successes can really be defined by who we're, like, one, who I am as a person, but then also who I'm, my immediate circle of people that I have around me. And then I think that kind of character and stuff shows on audition rotations. And then I think that's what really helps in the match cycle. Because when I sat down with our program director here, so it's funny, I've been off service and your intern year of plastics, a lot of it is just general surgery rotations. And so I'll be the first time I actually do my plastics, I'll be like on my service as a plastic surgeon, will be in January, which I feel like is just almost like a storybook. Like 1 year ago, I was a student in January, like showing up at 5 a.m., making sure that the list was ready, that all the residents had their lists ready, that it was correct, that I had my wound care bag and I had like all the dressing changes and like wound vac change stuff in there because we were seeing all these patients. And I made sure I had everything ready to then being like an intern on the service and being like, oh, this is like a weird like callback to um, just that small amount of separation. It'll be an interesting experience. But when I was there a year ago, almost, I um, I remember I sat down, and I guess the little tidbit, I forgot to mention this. A lot of audition rotations, if you rotate somewhere, they just kind of they count that as an interview. Um, some places will still interview you on top of the audition rotation, but for plastic surgery, a lot of places will just either interview you or they'll just kind of chat with you while you're there. Or they'll just be like, you were here with us a month. Like, this is better than a day interview. We know you pretty well. We'll rank you. Like, that's a lot of times how it goes down. So audition rotations are almost like free interviews. Well, not like free, but you didn't have to like submit the application and hope they interview you. You just kind of got it because you were there. Um, so I sat down with our program director here, and I remember talking with him, and I don't know if it was like burnout or if I had just like, it was my last rotation going into the ranking match season, and I was kind of just um, a bit more confident, but I just laid it all out there, and I remember I told him, I was like, look, I'm coming from an osteopathic school. Not many DOs match into plastics. Is this going to be an issue?
yeah, why not?
Because again, I'm like, am I wasting my time here? Like, should I be considering Penn State on my rank list? Like, how should I approach this? And he was, 100% honest. He's like, oh, I don't care. Like, you were great. And he kind of laid out his mentality. He's like, all the things like research, grades, whatever, they're like important aspects. But he's like, I really care about who you are as a person. Because from his perspective, and he said this, he's like, we're trying to find our next family member for the next 6 years. Because
Mm,
6 years is a long time. They take two residents a year. It's a small group of people. And if anyone's ever worked with one coworker that's really difficult to be around, it can really throw a wrench into life.
yeah.
Um, so for 6 years, they want to find somebody who's not, excuse me, that's not going to be an issue, but is going to be supportive and synergistic to one, the culture, but then to everybody around them. Um, and so that's what he said. He's like, that's what I care about is, are you going to be able to fit in as the next family member, and are you going to be able to do a good job? And that was kind of his main thing that he was looking for. And I felt like I really meshed well with Penn State, and I think that's why it worked out well here. Even though moving here was really difficult, like I am having an awesome time in residency, and I think a lot of people it can be a real struggle. I mean, it's tough. I'm working really hard, but I really love the people that I'm with, and I think that makes a huge difference. And the attendings are all great too. I love the faculty and the support system I have academically with my career, and I think that makes the biggest difference. But and I don't even know why I started talking about this. I feel like you mentioned something, but anyway.
Well, we started talking about the spark within. I talked about like I think it yeah, how did we lead into this? It was sort of a
Yeah.
talk about the potential and then
I think I was kind of talking about like the character of like, and that's why the program directors are going to care a lot about your character as opposed to, again, if you check all the arbitrary boxes, who you are as a person, have that shine, and that's really going to matter at the end of the day. And
yeah, just
having, and just have a good attitude. Um, yeah.
be a cool dude.
Yeah.
No red flags, no felonies.
No felonies. Don't be weird. Don't try to force it. Just kind of show up, do a good job, be chill. Um, it's weird navigating things as a medical student. I don't envy it. It's funny being on this side of things as a resident because I feel like I have this like clearer picture now of like there's so many times as a medical student I'm like, man, the residents just seem so like they like forget about me and they don't like, but now I'm so busy that they're I feel like I have a lot of empathy for some of the residents that I worked with as a medical student. I think some of them sometimes are jerks, but a lot of times now that I've been through a couple months of it, I'm like, man, that's really tough. And the fact that they even like knew who I was by the end of the month, like I think that's a win.
Yeah.
But yeah, I don't know. It's kind of an interesting perspective. Because yeah, I think it was one day I had like a million things going on. My pager's going off. I have all these tasks I got to do. There's consults coming into the ED, and I'm just like, oh my gosh, I got to do it. And I just get up and I walk out of the door, and I forgot that my medical student, because there was only one computer in the room uh, that they were sitting around the corner, like on their laptop. And I just like left, and because I had things I got to do, and I was halfway down the hallway, and I'm like, I just did the thing that happened to me as a student, and I'm like, oh, okay, like it was a learning moment, but it was also like a kind of an empathetic moment where I'm like, okay, I get what the other residents are going through when I was a third year medical student, and I felt like I was just left behind, or just like I stood there and I'm like, I don't know what to do. I'm just in your way. Yeah, it is what it is. It's tough navigating it, but it's possible.
You just got to be beast.
Yeah, right. No, that's probably a good mentality to have. Yeah.
Just be a beast. That's it.
Yeah, no, I because people always ask that question too. They're like, how do I like show up and I'm like present, but I'm not weird, I'm not awkward. I'm like, it's and everyone just tells you they're like, read the room, and you're like, but what does that mean? Like, it's tough. Oh, I would say this. Another piece of advice that I think really helped me. Residents are like they're open books. They don't care. Like they're not going to keep secrets from you. It, they're going to be the best resource on your audition rotations. And so every place that I went, if I was going to be with a certain attending that day, again, I would study up on all the cases and try to like know the anatomy, some of the basic questions they might ask me. But then I would also ask the residents. I'd be like, "Hey, I'm with Dr. So and so today. What are they like?" And they'll either say, because they know the game, they get it, and they're not going to keep things from you. They'll either be like, oh, they're just playing music, and they're just going to ask you who's like what song this is. That's all it's going to be. Or they'll be like, oh, actually, like they're really funny. They like to joke around, but you're doing like a hand case. They're gonna ask you this question, this question, this question, and they would actually like prepare me. And I'd go in there and they were 100% right. They'd be like, oh, they're really easygoing, but then they like to pimp on these types of topics. And so I went in there ready. Or they'd say like, hey, this attending's a bit more strict. They're probably not going to acknowledge your existence, but just go in there and like just be professional. But if you don't say a word the whole case, that's typically what happens. And I'm like, okay, cool. I'd go in there, I'd introduce myself, shake their hand, be like, "Hey, I'm a visiting student. I'm here." And they'd be like, "Okay." And sometimes they just the rest of the month didn't acknowledge my existence, but I knew that going in. So I just feel like, this is going to be another case where I just stand here and again have a good attitude. I try to like learn as much as I can, but I knew it wasn't going to be like other ORs or the attendings going to be like, "Hey, tell me where you're from. What do you like to do?" Um, yeah, and so ask the residents. Like they're gonna know the attendings. They're not gonna keep any secrets. They'll tell you they always ask these questions, or this is their attitude, this is their mentality. Um, that can be a good way to be prepared for when you go in the OR to not be weird.
Can't be weird.
So yeah,
You just
just
can't.
another little piece of advice that actually really helped me. Residents were always extremely helpful.
Yeah. Again, it's like just ask.
It blows my mind how scary it can be to just ask, but also how many times I was kind of blown away by like when I did ask, people were very like a lot of people said yes or like would volunteer to help. Like whether it was just finding a mentor, either asking them, "Hey, can you mentor me and like can I meet with you and you can help me navigate this?" Or, "Hey, can you make some phone calls for me? Can you write me a letter of recommendation?" I was blown away by how many people said yes. Um, and I remember I feel like there were probably opportunities that I missed because I might have been too afraid. I think as a medical student, it's easy to just psych yourself out. And it can be pretty nerve-wracking. But again, advocating for your own education, very important. Like don't be afraid to just put yourself out there because worst case scenario, somebody says no. And then in my head, I'm like, if they're not willing to help me, like it's probably somebody that I don't want to work with anyway. And then they saved us both pain and misery because now they said no, so I don't have to deal with it. But um, yeah, I think all levels, just asking for help. Um, I think again, important thing I learned early on, but then through even as a resident now, I think it's when I don't know what's going on, which is like 95% of the time or like 100% of the time, it's always just my senior resident or whoever just call my chief, be like, "Hey, what do I do?
Yeah.
I don't know what's going on. What do I do?" It's yeah. I think it's probably just a life experience, but
Yeah, it's a complex game to play. It's like you don't want to be too bold and arrogant, and you don't want to be too meek and shy. You
right.
want to just be that happy medium, you know?
Exactly. And I think that's tough. I don't know if there's a good way to know. There were times I was like, man, did I come across like an asshole? Or was this like, did I come across to like, hey, maybe can you kind of sort of, and I was just like beating around the bush or, um, it's tough. But I think again, if you have a good attitude and your intentions are there and you're genuine, like people are more than willing, like, just short, sweet, like, hey, I was wondering, could you write me a letter of recommendation? And it just again, I was always blown away by the support that I got, even just by asking. And I would encourage everybody to get outside your comfort zone. It's tough, but again, if I didn't, if I hadn't have pushed myself, to do those things, I wouldn't have matched in the plastics for sure. So that's Um, something that I had to learn early on, and I mean it's tough, yeah, because that happy medium, like you said, it's sometimes, and some days you win, some days you lose. Like there are times where it didn't come across the best way, and it's like you live and you learn. I don't, but it's an opportunity that like if I do nothing, then it's for sure not happening. But if I try, then something might come out of this. Like, so I'd rather like give myself a chance.
Yeah, it's better to try and fail than to have never tried at all.
Yeah, 100%.
So, Chris, as we wrap up here, do you have any other advice or wisdom or experience that you think would be valuable for a medical student to hear, particularly an osteopathic medical student, but for any medical student?
Huh. I'm trying to think. I mean, we talked about a lot of stuff that I probably would have shared. I think the big things I would just say is the advocating for yourself. Don't be afraid to ask for help. Um, the happiness thing. it's an intrinsic. Don't tell yourself, oh, I'll be happy once I get into second year of medical school or third or fourth year. Everything will work out once I'm in residency. And then you end up telling yourself that until the day you die. Um, I'd say learn how to, again, plan for the future, but live in the moment. Um, Try to develop the relationships and have a good time and be happy now and not just think that some external thing is gonna give that to you in the future. Because again, like my story describes, nothing went to plan at all. And if I was hoping that it was all gonna make me happy, like I'd be miserable. So, um, I think that's probably the big thing that I would say as well. And then um, having the backup plans and having an open mind. I am extremely grateful I matched into plastic surgery. I think it was a lot of hard work, but also, I mean, it was a little bit of luck, and I think the match worked out in my favor. I know that there's a lot of people that the match didn't work out in their favor, even when they were more qualified applicants than me, in my opinion. And I don't know the reason why, um, but it could have been me. Sometimes I'm like, it probably should have been me. Um, but I think I'm be grateful for the good things that do happen, but then also plan for all the things that, be realistic. I think as an osteopath, if you're interested in plastic surgery or other competitive specialties, I think it is very much possible. It's going to require a lot of sacrifice, and it's not going to be fair at all. Yeah, I remember there are a lot of times I was like, this sucks. I have other friends either at other medical schools that it seems just a bit easier for them. I mean, grass is always greener. I can't fully speak to their experience, but it always just seemed like, or if somebody wanted to do a different specialty, if they wanted to do something that was less competitive, a lot of my friends were, hanging out on the weekends, going and having fun, and I was studying. I still tried to make moments where I took free time and I took time off and I had fun, but it was less than other people who were doing other things. And that's just kind of how it is. Felt unfair, but I think setting that realistic expectation that I'm going to have to work hard and this may not work out. I could have easily ended up in general surgery or maybe even soaping into something else. And that was very much a real possibility for me. And so I think mentally being prepared for that and accepting it, because again, my happiness wasn't going to come from whatever specialty I got into. It was just going to be from me as a person and me succeeding at what I'm doing. And I knew no matter what I got into, I was going to be successful at it because I wouldn't do anything otherwise, right? Um, and so I think just having that kind of mentality and being prepared for that, I think those are probably the three things but we've already kind of talked about it a little bit. Um, I don't have much of anything else unless, what kind of advice would you offer um, other medical students or even pre-meds if they were thinking about medical school or maybe something?
You know, if I were to, let's say this is a guy that wants to get into medical school.
Yeah,
Oh, I think I would if right now I had someone in front of me asking me, Curtis, what were like your three big tips for getting into medical school? I'd probably tell them work as hard as you possibly can to ensure your success. I mean, it goes along with the relentless pursuit of your goal.
right.
Limit your distractions and prioritize your success and orient your behaviors towards the attainment of those goals, first and foremost. So work your
Yeah,
ass off, do whatever it takes. And on top of that, work hard and play hard. Once
yeah,
all your work's squared away, go have some fun, let loose, do what you got to do, but only and only when the work is done.
yeah,
Secondly, I would probably say network, be a cool person,
yeah,
research as much, research in term, I mean, like look into what you need to basically find out what you need to do and do it.
I wish I spent more time. I kind of wish I shadowed a little bit more because I would have been able to have more experience in different specialties and learn more. And then I would have been able to I mean, hindsight's always 2020, so I can't go back with the same knowledge, but I think kind of like what you just said, learn about the process. Because I learned the hard way, and that sucked. So, but sorry, what was the other thing you were gonna say? You said networking.
Well, yeah, really, like work as hard as you can, find out what you need to do and do it, make the connections with the doctors, with the students, find successful mentors, right?
Right, yeah.
And lastly, really just, and it just embrace the suck. Get used to suffering, love the pain, love the
Yeah.
challenge, and accept that that's what it is. You're going to be a doctor, man.
Yeah. And 12 step, they talk about leaning into the pain. Yeah. And taking it one day at a time.
Yeah,
Yep.
exactly. And it's a beautiful thing.
Yeah.
Beautiful thing.
No, yeah, rolling with the punches. It's like working hard, but yeah, and no, nothing ever. And kind of going back to what you were saying, and I'd say this too. I always hated it when my mentors, because I'd be so stressed, and they'd say, "Well, everything you'll end up where you're supposed to be." Like people kept saying that, and I was like, "What does that even mean?"
Yeah.
That doesn't help me. But again, I think if all of us worked as hard as we could and we put in our effort. I mean, again, some days are better than others. I can always beat myself up and been like, oh, I could have worked harder, I could have done this. But again, I was trying my absolute best with what I had and how much I knew. Um, and I think we all end up at places for whatever reasons. I think we end up where we're supposed to be for certain things. And things work out the way that they're supposed to. And sometimes it goes according to plan. A lot of times it doesn't. If plastic surgery was the goal, I should have just, studied, like, aced the MCAT, gotten into like a really nice allopathic school and just like became a plastic surgeon. But like, that's not how it worked out. And I'm kind of glad it didn't because if I didn't go to medical school where I did, like my wife's career probably wouldn't have gone the direction that it did in a really good way. I wouldn't have made some of the friends that I've made that are like lifelong close friends. And like even I'm just like good friends with their families too. Like these are the families outside of my family in medical school that were supportive and like there for me. I wouldn't have had that experience. I wouldn't, if I didn't meet the people I did, I wouldn't have met, um, like sorry, another side story, just talking about pursuing all connections, and how it can lead to certain things. Like
Sure.
why Penn State? How did I get this audition rotation and now I'm here? Um, I rotated at that hospital where I like asked, "Hey, can I step aside and see these plastics cases?" And I did that, and then I met the resident from the plastics program at Mayo, and she was kind of like a pretty good mentor. Like I remember I was struggling with audition rotations, and I reached out to her and I said, "Hey, I'm really having a hard time. I was wondering if I could pick your brain." And she's like, "Okay, well, it's been a few years since I've done this, but my friend." That's from the medical school that I went to. She actually is interviewing for plastic surgery right now. She just did audition rotations. Why don't I connect you with her? And so she reached out to her and she said, yeah, I'll talk to him. So I got this person's contact info at the like University of Nevada, Reno. Um, never met her in person, but I've talked to her on the phone a few times. I get her contact info. I talk to her about audition rotations. Everything falls through the cracks. I reach out to her again. I'm like, hey, I'm really struggling with finding places. And she was like, actually, you know what? Penn State has a DO physician on their faculty. Like, why don't you just see what happens with that? And I had no idea, but I guess she had done some research and she knew that they were there. So I applied and I got an audition rotation with them and then ended up matching here. And so it's kind of this like weird trickle down. I end up at medical school in Arizona. I meet this person who knows this person who then has this little piece of information that guides me to finding an audition rotation that works out that I then end up I'm living here for 6 years now for residency. So to put it all into perspective, you never know how things are going to work out. So again, advocating for yourself, but then also um, yeah, I think we all end up in the places that we're supposed to be with however it works out. And again, I'm grateful and fortunate to have matched in the plastic surgery, but I mean, you think about the process of even me just knowing about Penn State, like that was, again, very fortunate. We all end up where we're supposed to be.
Isn't it just fun how some things work out like that?
Yeah, I feel like that's like a good story to share because it's just like so random, but it ended up working out. And now here we are. It's crazy.
It's so weird how the chain of connections can
Yeah.
just be so strange like that. Yeah, that's
It,
cool.
yeah. It's wild. Yeah. But again, like it's been a great experience. I've learned a lot, still learning. Um, and then I guess the other piece of advice, sorry, we're just gonna t this is gonna be a 3 hour podcast. I hope you're okay with that.
Fine by
Um,
me.
I'd say pay it forward. I'm grateful I was able to talk to you on here. But I remember, and I think this also may have helped my application, but I actually started the plastic surgery interest group at Midwestern. Um, and I'm still very much involved with it because I remember how painful and awful it was for me to just do all this by myself. And so I'm trying to provide those resources, paying it forward to like if you're a first or second year medical student and you're interested in plastic surgery, like, well, you can join this group and I try to meet with them on a regular basis. We actually are setting up a meeting with my mentor, Dr. Mast, so that he can talk to them and chat with like an actual like big league plastic surgeon. Um, an opportunity that typically people wouldn't get at an osteopathic school. And so I think whatever success you find, share that with others. Don't have this stupid gunner mentality of I need to allocate all resources to myself so that I can succeed because I can't have anybody else getting in my way. Other people's successes are your successes. And if I look at how many little things fell into place for me to succeed in plastic surgery, and that was other people, like I need to I'm so grateful for those people. I try to be the same type of person. So, like if everybody had just said no to me, the door would have been slammed shut. And so I try to have that same mentality. Like when I reached out to my mentors or these residents or other medical students and asked for help and they said yes. Um, I try to have that mentality, and I would just encourage others to do the same because you never know what kind of positive impact you would have on like a pre-med student with some of the advice that you just shared, or if you're a third year helping a first year, fourth year helping a third year, and then residents and so on. It's um, kind of a big physician family. We're all just kind of helping each other survive, like what you said, the suck
Yes.
of the system that can really just beat us down sometimes. I think if you surround yourself again with some good people and then you try to also be a good person that somebody else can surround themselves with, it ends up being this, again, synergistic thing that we can all help each other. So another little thing that I would toss in there too.
Yeah, and that's what part of why I like doing this podcast is because it's
Yeah.
a way not only for me to learn valuable advice, but it gives other people the chance to hear it as well. And it's just like a just kind of part of the ecosystem of us
Yeah.
medical people.
Yeah, I think no one else really knows what we go through except for us. And I think that's why my wife always jokes around. She's like, "Yeah, when you get around your resident friends, you just never shut up about all the stuff, excuse me, that you're going through." And I'm like, "Yeah, because it's so wild that like this is what's happening and no one else understands this but like my co-intern and me and her need to like vent for the next 4 hours because some of the stuff that's going down is just ridiculous." And same as medical students, like just some of the BS you put up with and just like how much you're studying and how stressed you are and how ridiculous it is. Like no one quite understands except for some of the people that are around you. And they can be your best assets, just having that support system of people who can be there for you. So, but yeah, I 100% agree with what you said. It's that ecosystem is it's a delicate one, but it works if it's a positive one.
Yeah.
So I said again, like all it takes is one person with a bad attitude that can really throw a wrench into things. So having like a good attitude and then helping other people, like don't just that. I there were a few people that, and I was kind of surprised going through medical school when they like kind of had that gunner typical attitude where they like found something that was really helpful and I'd be like, "Oh yeah, like who'd you talk to? Like where'd you get this? I need help with that too." And they'd be like, "Oh." I'm like, okay, well, me and you aren't friends anymore. That's like that answered that question for me real fast.
Yeah, it's like boom, man.
Yeah, exactly. I'm like, I don't have enough time to deal with this. So like, see you later. Like, and it sucks. So don't have that mentality. Again, everybody's success is it's a shared thing.
Absolutely. I'm curious to this is kind of a random question, but are you a guy that contemplates mortality often?
It's funny that you ask that. I think my attitude towards it and I think my understanding of it has shifted, especially with like being realistic. I bought third party disability insurance because Penn State offers disability insurance, but in my head, I mean, it's okay. It's not the best, but I was like, I've dedicated so much of my life towards this. I am fine paying so much a month to just ensure the fact that if something happened to my hands or my eyes or like I would at least financially kind of sort of be okay. Um, and then I think just like my attitude towards my mortality, it'll shift, I think as because are you a second year medical student or
So I start medical school next July.
Oh, that's right. Sorry, I totally confused that. For some reason I thought you were in your second year. That's right. You start soon. I remember. Um, sorry.
Oh,
This
no
is even
problem.
better then. When you start your rotations, you it'll be a big learning experience the first time you see somebody die.
Oh yeah.
Um, and I remember there were multiple times through medical school seeing that happen. And medical school, and then as a fourth year, and then especially as a resident when you're actually like assisting in somebody's care and they're very sick. Um, I think, and then you either they really struggle and they just live in the hospital for months, and maybe they get out. Some people, sometimes they don't and they pass away. Sometimes, they get put on comfort care, hospice, they go home and pass away. Um, I think it can be very easy for us to just it becomes the norm and it isn't really normal. Like normal everyday people don't like go and they're like, "Oh, I wonder if this like in the morning I wake up and I'm like, I wonder if that patient is alive or not." Um and I think my attitude towards it I think has deepened as far as like my respect for life. And then also I think my attitude towards my own health has shifted a bunch. I probably care too much because the resident we're working so hard at like, you watch the TV shows, it's pretty typical for everybody to like be awake forever and they don't sleep and they don't exercise, they don't eat well, they just live in the hospital. I prioritize uh my health very much. As far as like getting good sleep, eating quality food, uh, avoiding as much processed stuff as I can. I have a sweet tooth, so it's tough because that can be an escape for me, eating candy, eating my feelings. I think that's a pretty common one. And then also exercising. I know it's funny as physicians, we always talk to people about their diet, lifestyle choices, things like that. But now I'm in my 30s and there's some patients that come in the hospital that are either my age or not too far off of it that are very sick. And I'm like, that could be me, like if I don't take care of myself. And it's interesting how much of an impact it has on my mental health, my emotional health, and then even just taking care of my physical health, um, which I think just enhances my ability to be a good physician and resident. So when you ask, like, am I somebody who contemplates mortality? I joke around, but I'm kind of serious when I have like my stack of some vitamins and supplements I'm taking, and then I try to make sure I'm exercising a certain amount every night, and I'm like, I need like this many hours of sleep. And so, sometimes it goes to plan, sometimes it doesn't. I'm a little obsessive about it. My wife probably thinks I'm weird, but I'm like, I don't want to have a heart attack by 50 and then be one of these patients that has to deal with these types of angina type chest pains and difficulty breathing, and then all of a sudden you're now dealing with heart failure, and now your legs are swollen because your heart doesn't work, and then you develop this really nasty ulcer on your leg, and then it doesn't go away, and then you get this nasty infection, it it just declines. And
Yep.
I've seen it happen, and I'm like, that's not going to be me. Or at least I'm going to do everything I can to avoid it. Because, like medical school, life is also a marathon, and the little things we do every day is kind of what ends up determining the outcomes later on. The little things I did every day in medical school really helped me match into plastic surgery. I think the little things I do every day in life help me succeed just as a person, but then also health-wise later down the road as well. So
Are you a big reader?
I try to be. I wish I had more time. I there's a lot of books that I want to spend time reading. I think audiobooks have kind of been the way that I have like listened to other things. I'm I enjoy podcasts, and I think just like other other people or experts kind of that have YouTube channels that talk about different things or topics that I'm interested in, whether that's health or fitness or even just like medical school or residency. Um, yeah, that's kind of my like how I gather information. But yeah, I wish I read more. What about you? Is that
I think everybody who reads wishes they read more.
yeah, right?
I try to read. I mean, but I also have nothing but time right now with this gap year. You know what I mean?
Oh yeah, you're chilling. You can read all the books you want. Enjoy this time.
Yeah.
Um, I think you asked me like the transition into residency. It's probably similar to the transition in medical school. Nothing's gonna prepare you. So just enjoy life right now, and then once you start, you can worry about it then. I remember my chief resident. She was like, "Nothing's gonna prepare you, so just go on a vacation, enjoy life. Don't worry, you'll have plenty of support to ask anyone how much Tylenol you give a healthy patient once you start residency." Because again, it's like what's gonna like make her like whatever you do right now isn't gonna change much as like when once you start medical school. But yeah,
You know?
I wish I read more.
Yeah. It's always, I mean, have you ever heard of Eckhart Tolle? You mentioned, you're talking about the spirituality sort of discussion, like
I
finding
actually
happiness
haven't.
within. You'd
Eckhart
like his
Tolle.
work.
I'm gonna write that down.
I'm working through one of his books now. It's called The Power of Now, and how
Okay.
true deep joy is only accessible in the present moment. You have to be truly present in order to be content. It's like your degree of well-being is directly correlated with the level at which you are in the present moment. It's like, cool, man.
I
I can do that.
100% agree with that. And I think it's tough as physicians for us to do that because everything is such a long term. Everything is later, right?
Hmm.
You're about to start medical school, and then you'll start medical school, and it's like, ah, well, then it's like second, third, fourth year. Residency is 4 years away, and then residency, it's like, okay, I'll be an attending in 6 years. Like everything just seems it's so far away. And so it's easy to just be caught up in thinking about the next thing, like moving the goalposts. Is what a lot of, I think, another term that I feel like a lot of us end up doing. And I feel like it's us robbing ourselves of happiness, of enjoying. That's why I try to say, like, plan for the future, but live in the moment. Because, I mean, you need to be aware of the things you got to do to succeed later on, but at the same time, appreciate what you're doing right now and the successes you're having right now. Like, I did really well on this test. Like, okay, awesome. And then celebrate that moment. And sometimes they're brief moments, but I think having that moment's important. And then you can go to the next moment and appreciate it for what it is. And then also appreciate the tough moments too.
Yeah.
I think those are all like again, I think there's some really shitty moments that can be great learning experiences. Sometimes it's like looking back on it, learning from it, which I feel like I had to do with a lot of my life, but then also appreciating some of those tough moments, like the first time that a patient came into the trauma bay and was coding, and you're like part of the whole CPR process. And after like however long of doing so many rounds of CPR, they're finally like, "Hey, does anybody else have any ideas?" And they're like, "No, we've exhausted everything." And then they call it. Like, okay, you know, 11 whatever, this patient died. And I remember I stood there just like looking at this man that I just watched pass away. And that was a very like surreal, um, I don't know how to describe it. I think again, it kind of made me appreciate, again, my life, but then also understanding, the human body and like the effort that we're putting into understanding medicine that we can use to try and help people. Um, Trying to give everybody, like, I appreciate everybody who gave me a chance. We're trying to give these people chances at, maybe recovering and or prolonging life. And I mean, sometimes it's easier said than done, but yeah,
Yep. Yeah, there's nothing like an experience. Nothing compares to the experience of witnessing death right in front of you. I mean, I've never
yeah,
seen a patient actively like alive and then dead. I've only seen them basically code. Like I worked as a scribe in undergrad. I
yeah.
remember
So you've
seeing
probably
the
seen people
patients
come
come
in who
in.
are pretty much, yeah,
Yeah.
they were not doing well when they came in. I think the other experience I had was on my audition rotation for general surgery. I did a surgical ICU rotation, and there was a patient who came in that was really sick. I mean, he was well enough. Like I went in, talked to him, knew him. He was not doing so hot. He had to have these surgeries done, and even those were kind of iffy. Like if he was even going to make it through those. But then once the family decided, like, hey, like we're not going to pursue anything else. Like this is too much. And then I remember they unhooked everything, but I could see on the telemetry. I remember sitting at my computer and I could see out of the corner of my eye. Um, it just like his heart rate just slowly going down and his respiratory rate just slowly going down and then flatline. So like, I watched a guy come in that I mean he was still sick, but he was alive. We were trying to help him and then actually watched him die. And that was and the family, I mean, they were in there with him, and I could hear them. They all start crying because they sat there and watched him die too. That was also a big learning experience too, I think, being a part of that. Um, because then they also had me. I went in and helped the nurse. Like I tied the tag onto his toe and like helped place him in the bag and like zipped him up so that they could take him to the patient to the morgue. And that was like being respectful of the patient even after they've gone and like the family they're all distraught and they're like hey please take care of our what that was their dad, it was their brother, whoever it was. um it was interesting just being a part of that experience and just like trying to give him the best that I could even after he died. It was just show him the respect that we can. And um it was, yeah, that was an interesting experience. I think you're gonna have those when you go through medical school and then especially when you get into residency. Um, and I think try um, some of my mentors. I think some of the advice that they gave that I really appreciated was one of them told me to like really appreciate those moments and to not forget them because I
Hmm.
think it really reminds us that we're human and that our job isn't very typical. Like normal people, that's not like a daily occurrence that it's like this is what's going on. And it can become, not that we become cold-hearted to it, but we almost become used to it. And so our reaction to it isn't going to be like any other normal person's. We can just be like, oh, this person died. And then we move on. Like, but then for these people, like the family members, it's not that, oh, this patient died. It was, oh, this was somebody important to us. And so
Hmm.
I think it's important for me to try and remember, like, hey, like, again, be in those moments. Don't let them just like, whatever. And then, like, I think it's important to grasp them. And then also to never let go of our hobbies. Because again, I think all of us are much bigger and more important than just medicine in and of itself. Outside of surgery, who are we? I don't exist just to do plastic surgery. So I think those are important aspects to try and remember and hold on to.
Absolutely. Absolutely. And I think this would be a great stopping point because we can end on a positive note. even though we're talking about mortality, we can frame it in such a way that's like, I read this once, and this is Mark Manson, The Subtle Art of Not Giving a F.
Yeah.
Um, it's like death is, what is it? Death is the shadow that gives the light of life. I'm gonna butcher this. It's like death is the shadow that gives measure to the meaning of the light of life. So in the face of our mortality, we can in turn value the moment and
Right.
cherish what we've got.
Because if it was never ending, none of it would matter. I think
Exactly.
I think things matter and they're important to us because they do end. Um, it was sad, like when I've had important people pass away in my life. It's a sad moment because again, it ended. And that's why it was so important to me. I think that's why it's so important to me with certain moments in my life because things begin and end. And yeah, I agree with you. I think the fact that there's a finite point is what provides so much meaning. Because if it was just endless, then it becomes meaningless. So yeah, I 100% agree. So maybe that's why this podcast is going to end because provide this some meaning, you know?
Yeah, exactly. So, Chris, it's been great talking with you, my good friend. Thanks
I
for sharing
appreciate
all your
it.
wisdom.
No, thanks for having me on. This was a great experience. I enjoyed talking with you. We let's do this again sometime.
Absolutely.
Okay.
All right. Take care.